as always. Joining me now on set to talk about some of the medical questions surrounding coronavirus is Dr. Lipi Roy from the NYU Langone Medical Center. Thank you very much for being here. And I still wonder what this test entails. What can you tell us about just the protocols involved with this? As we hear from the White House now, more tests have been manufactured, the private sector's involved, and they're being sent out. How intricate, how difficult a test is this to take?
So thanks for having me on, David. This is such unprecedented times right now, right? So as we've been hearing time and time again, we need a lot more tests and widely disseminated, because we just have no idea what really the true scope of this problem is. My understanding so far about this test is that, like the rapid flu test and other influenza tests, it's going to be like a swab. We need to get more information though, but the key for me is going to be the rapidity of the results, because right now the tests take anywhere from 1 to 4 days sometimes to come back. We can't really do that. We need something with more rapid results.
Talking a few moments ago with Sherry Fink of the New York Times about capacity in hospitals, and you got your degrees in public health and medicine at Tulane in New Orleans. You know what happened with Katrina so well. How instructive is that, what happened there, as we talk about capacity, as we look to building temporary structures and having the beds that we may need should this advance as much as we think it will?
Yeah, so, you know, here in the United States, we have a state-of-the-art care. We really do in medicines, and yet having said all of that, we're going to really face massive burden on our healthcare system. And if the numbers of people who are truly sick, requiring like inpatient level care, if it gets to be extremely high, it's going to paralyze our healthcare system. So we already know that we don't have sufficient ICU beds. We have an insufficient number of ventilators or mechanical ventilation instruments. So again, it can be bad, but we can prevent all of that by doing what Dr. Fauci said, which is really blunting that curve in terms of number of cases by using preventive measures. That's the real way that we can all collectively reduce those numbers.
Very quickly here, what is your prescription for dealing with all of this? Yes, the news flow. Yes, the overwhelming anxiety about what may happen here over X amount of time. There are people who are burdened by that anxiety.
Trust me, I'm getting phone calls, text messages every day from my mother, from colleagues, from relatives all over, from the UK and India and all over the world. People are understandably really kind of freaking out right now. I get it, I really do. I'm an internal medicine doctor. I'm also an addiction medicine doctor. So a lot of my patients are really experiencing drug issues and mental health issues. What I would actually kind of focus on is, yeah, these are unprecedented times, but maybe take this opportunity for like maybe some self-care. Stay at home, maybe catch up on sleep, do some meditation, cook, bake, read. Take this opportunity to really just take care of yourself and know that things are going to be okay.
All right, sound advice. Lipi Roy, thank you very much. Nice to meet you. Thank you very much. Lipi Roy, of NYU Langone here with me.